Good evening. My name is Gaberlia Ugwu. I am a student of University of Massachusetts. This is my integrative video for NRU 642 assignment. I will give you an overview about my patient, Betty. Betty is a 28-year-old African-American female originally from Nigeria, born and raised until she came to America at the age of 17 years. Patient presented today in the clinic for therapy section and has recently been diagnosed with depression and anxiety. Patient is currently not on any psych medication, and patient is known with has no previous history of mental health disorder. Patient reported symptoms of feeling of hopelessness, helplessness, fatigue, feeling of sadness, irritable, easily frustrated, and trouble falling asleep. Patient reported that she has tried self-cope but still not getting better, rather feeling worse. That is why she's here seeking for help today. Patient stated that her childhood upbringing is affecting her and she is not able to focus. Patient stated that she's growing up in a highly malfunctioning family, stated that in her own words, "Nobody loves or likes me. Everything I do is wrong." Patient reported that growing up in Nigeria and in a polygamous family, her father married 3 wives and her mother was the first wife out of the 3. Patient reported that her father, careless of her and her siblings, does not get them their basic needs. All he does was bring money for food and sometimes pay school fees. He does the bare minimum, which was achieved with fight and argument. Patient stated that when she asked her father for money for personal needs, he will curse her out, making her feel unwanted. And so throughout her teenage life, she cries almost all the time due to not getting her needs met and feeling unwanted, hopeless, helpless, and her father makes it worse for them by beating their mother up in their presence. Patient stated that she came to America as a student and was happy for the change and hoping to start a new life. Was able to sleep up to 7 hours at that time, but recently she can no longer sleep well or even stay asleep. Currently sleeps about 3 to 4 hours at night only. Patient denies any suicidal or homicidal ideation. In Nigeria, most men tend to keep polygamous family, and it is not seen as anything wrong. It is believed that it is the man's choice and he has the right to marry as many wives as he wants. But children that were born under this condition of family goes through a lot of maltreatment, uncared for, and the community does not see it as anything wrong. Most of the time, their mother is their full caretaker. Patient reported that her father believed he showed them love by providing food and paying school fees sometimes. Patient stated that upon coming to America and seeing how family do and how kids are taken care of, she became withdrawn from the society. Patient is currently married with 2 little kids and her relationship is very unhealthy. She reported that her husband does not treat her well and that increases her anxiety and depression, taking her back to her childhood life. Patient stated that she has not spoken to her father for about 7 years now. Patient works as a teacher but feels unaccomplished with her job and family. She denies any use of illicit drugs, smoking, or use of alcohol. For the therapy section, with this patient, Betty, we will be using 3 modalities, and they are cognitive behavioral therapy, CBT, interpersonal therapy, motivational interview. Definition of keywords: maladaptive thoughts or thinking is a belief that is false and rationally unsupported. These thoughts are usually formed as a way to protect us from triggers and trauma circumstances, and it can be caused by personal history, emotional dysregulations issue, and so many others. Automatic thoughts. These are thoughts that are not necessarily true, accurate, or helpful. It is often based on emotion rather than fact. It disrupts our perceptions of reality in a negative way. This automatic thought steals your happiness and rob you of your joy. Cognitive destructions. These are internal mental filters or biases that increases our mystery, fuel or increase anxiety, and make us feel bad about ourselves. These are thoughts that cause individuals to perceive reality inaccurate. I will talk about CBT therapy first. CBT is the most studied type of therapy and is evidence-based for the treatment of depression and anxiety. CBT uses thinking process of both negative and positive. CBT is based on using positive thinking to reform negative thinking, and this is achieved by going through reality check of the situation. CBT can use the thinking, feeling, behavior triangle, which means how an individual thinks affect their feeling and then reflect in their behavior. Cognitive behavioral therapy works for my patient because CBT is based on what we think about what we think about our life experiences, which affects our feeling and then how we behave. This is what is going on with my patient at this time. The therapy model will help to dictate destructive thoughts and then help to alter it to find a better way to change it for a positive outcome. For this patient, she believes that her father gave her emotional abuse by making home very unhealthy, and her core belief is that her childhood upbringing is full of emotional abuse. And this core belief is and her core belief is no love has made her develop a negative feeling of herself and not being lovable. The next therapy will be interpersonal therapy. This is based on resolving interpersonal issues and symptomatic recovery. It is used for treatment of depression. This therapy is good for my patient because she still have negative thoughts and feeling towards her father and somehow and very resentful. The therapy will help to address the disrupted relationship between Betty and her father. The third therapy modality will be motivational interview. This helps the individual resolve an ambivalent feelings and insecurities to find the internal motivation they need to change their behavior to positive behavior or thinking. We can also refer to motivational interview as a directive client-centered therapy. This style, therapy style that elites behavioral changes by helping clients to explore and resolve ambivalence. This therapy section is based on collaboration between the therapist and the patient, which will help the patient to plan for change. And this is done by engaging the patient to talk about the issue, keeping the patient focused by narrowing on the pathway to identify the habits the patient wants to change, and at the same process invoking patient's ability to change and also plan towards practical ways for patient to achieve these goals. Understanding cultural diversity while providing therapy to a patient is essential, and to know how these three modalities will be implied into the culture is essential also. It is important also to understand how culture shape mental disorders like depression and anxiety. Cultures play a big role in ways mental health issues are seen, treated, and accepted. For this patient, mental health issue in Nigerian culture is seen as not real and rarely not addressed. And fathers not taking care of their family responsibility is seen as a normal behavior. All right, now I am going to bring in my patient. Hello, Betty. How are you doing today?
I'm fine, thank you.
My name is Gaberlia Ugwu. It is nice meeting you again.
Thank you.
Do you give me consent to record our section?
Yes, ma'am.
We are going to have 3 sections of therapy for you. One, we shall have a specific goal for each therapy. Last time I saw you, you stated you were depressed and feeling anxious. You reported feeling helplessness, hopelessness, fatigue, irritable, difficulty sleeping, or staying asleep. You stated that your father emotionally abused you and did not show you fatherly love or caring. Do you still feel the same way?
Yes, ma'am.
The last time I did your PHQ-9, your score was 14. And today, your score was 12. Any change since the last time I saw you?
A little bit, but not as much.
I'm sorry to hear that. Okay, you said you still feel depressed?
Yes, ma'am.
What does the thought mean to you?
That I'm worthless.
Sorry to hear that. Let's look at the situation together and find a way to make things positive, something positive out of it. I will be using a therapy technique called cognitive behavioral therapy to help address the situation. The CBT we will use today is called Fact Checking Thought Worksheet. This will help us to see if your thoughts are fact or option or opinions. And I will ask you some questions and you will tell me if it's a fact or opinion. Are you ready?
Yes.
Okay. I am worthless.
Opinion.
I am helpless.
Opinion.
I am unlovable.
Opinion.
My father is a bad man.
Opinion.
My father hated me.
My opinion.
My father emotionally abused me.
Opinion.
Okay. We have more questions that you will complete at home as a homework. This is the end of our first section, therapy section. Thank you for giving me the opportunity to be your therapist today.
Thank you, ma'am.
When completed the question, which was about 6 questions, we compared it for the facts and opinions thoughts. Filling out the worksheet can help the patient come to reality check that her thoughts were opinions but not facts. Knowing this helps the patient to address the dysfunction or harmful opinion and then help to change to more positive thought. Now we're going to go to our second section. Hello, Betty. Welcome to our second therapy section. My name is Gaberlia Ugwu. Please, do I have your consent to record our section today?
Yes, ma'am.
Thank you. The last time I did your PHQ-9 test, your score was 12, and today you're 9. Are you still having those thoughts?
Not as much as.
Very good. Today, I will introduce you to another therapy called the interpersonal therapy. Interpersonal therapy, this is based on resolving interpersonal issue, which helps in the treatment of depression. With this therapy, I have a set of questions I will ask you, and we will discuss the answers later. What makes you think your father hates you or do not love you?
Because of his behavior and reactions to me.
Okay. What is your belief about some of the good things your father did for you? And how can you let the past go and move on to the positive way? We will discuss the remaining questions later, and we'll come up with the answers. Okay.
Yeah.
But for your homework, I will want you to deliberate and think about the questions. And also, I want you to practice automatic talk recording. While doing this homework, pay attention to identify troubled thoughts, how it affects your emotion and your thoughts. And then bring it to you in the next section.
Okay.
All right. We are back to our first section. Hi, Betty.